Hello, hello, hello.
Good morning, guys. How's everybody today? Who's here? Who's here? Who's here with us? Today, you guys, I have Malena
Mm-hmm.
S with me, and I wanted her to come on so that we could talk about fibro. And my relationship with Mel um, started out by her helping me understand the differences in my MS pain, my fibro pain, and like my back pain. So I invited her on this morning to come and tell her story a little bit. So, Mel, do you mind introducing yourself?
Well, my full name, whatever, first name is Malena, but I tell everybody to call me Mel because I've been Mel for most of my life. It's a lot easier to remember than Malena. Um, I'm a single mom. I have a 20-year-old and a 16-year-old here living with me still. Um, I was diagnosed with MS in 2013 and then fibro in 2016. And shortly thereafter, diagnosis with fibro, I had a fibro flare. And I remember my doctor asking me, how do you know that this is a fibro flare, not an MS flare? And I said, well, with MS, my vision is the first thing to get wonky or goofy or crazy. And my eyes aren't affected this time. I have chronic, it's widespread pain, which is not something I've ever experienced with MS and any of the other MS flares. And at that point, I'd had like 4 or 5 MS flares, some very significant. And so at that point, go ahead.
Can I ask you a question?
Mm-hmm.
All right. So, what year were you diagnosed with MS?
2013,
2013. And then what year were you diagnosed with fibro?
2016.
So 3 years later came another diagnosis. Did something set you out looking for more information? Were you having any kind of symptoms or anything?
My neuro, I was speaking with my neuro about it, different issues that I was having, like the pain throughout my hamstrings, my arms, like actual muscular pain. It wasn't anything like zingers or electric shocks or anything that I would get from MS. And she says, I think we're going to have to send you to a rheumatologist because it sounds like fibro to me. And then when I saw the rheumatologist, he did the pinpoints where he applies pressure to different pressure points in your body. And if I remember correctly, I think there's 20. I can't remember for sure, but I know that I have all but 3.
You have a little bit of static, sweetie. Can you scoot back a little bit?
Yeah. Is that better?
Maybe if that, we'll see. Go ahead. It was just kind of fumbling what you were saying.
Oh, okay. I'm sorry. Sorry. But
It's okay. Okay, go ahead.
um like
Where
I
you
said,
had
go ahead. I had
some pain.
chronic muscular pain. And I had noticed that that wasn't anything that I'd ever experienced before with MS. My MS symptoms usually, I refer to them as electric shocks, and they go throughout my body. I call them zingers. Um, like I said, visual pain is the sure sign of an MS flare for me. And in talking with my neurologist, she said, it sounds like you have fibro to me, and I would like you to go see a rheumatologist. And when I saw my rheumatologist, there are pressure points in your body. Like I said, I think there are about 20 of them. And they will apply pressure to these 20 points. And if there's any kind of painful reaction to that kind of stimuli, I think it's 12. If you have 12 or above reactions out of those
Like
20.
trigger points.
Yes. And I had all
So
but
they, can you slow down a little bit and explain again how they do that test to discover fibro?
They will apply, it's just firm pressure with their hands. And this is one that I suffer from in the front and in the back. And they will just apply, a firm pressure to it. And
To 12 different spots
yes,
on your body.
correct. Knees, elbows, shoulders, lower back, your hips, and in the front here, and like I said, the shoulders back here. Those are the ones I know for sure. And those are the ones where I reacted. Every time he pushed, I would wince. And I mean, I'm medicated right now. I can still tell I'm pushing here, but it's not as bad. Yeah, definitely tender.
And just right quick, not to throw you off, I did want to let anybody know that we are going to address the questions. I'm just want Mel to be able to tell her story and talk, and then we will answer some of the questions, because that's why I have her here. That's why we're having her here for Fibro.
Yeah, yeah. And I remember, again, the first fibro flare I had, he asked me, how did I know it wasn't MS? And I explained to him that the very first thing that happens with my MS flare is visual. And again, I say my because everybody's different across the board. And so I wasn't having any visual issues. I wasn't having any of my zingers. And I explained to him all of that. And then he says, okay, I do believe this is a fibro flare. Let's get you medicated accordingly. So that's what we did.
Did that start helping?
Yes, definitely. Definitely. I had to sleep a lot though during that fibro flare. Sometimes for me, again, everybody's different, but for me, sometimes the best thing for me to do is sleep. And thankfully my children understand that and will pick up the slack.
Can I ask you, do you get relief from your sleep?
Oh.
And if so, in which way?
It's funny. Sleep is a very tricky thing. During a flare, I have to find a comfy area and a comfy position because everything hurts. Sometimes it's on the couch, sitting up, reclined. Sometimes it's in my bed. And there again, too, if I do sleep for too long, it can make the symptoms worse. So
right.
There's always a catch-22 when it comes to sleep.
Yeah, it is unpredictable still, right, in your sleep.
Mm-hmm.
But
Definitely.
do you say some of the sleep gives you a break from the pain?
And exactly. The reason, and I have explained it to my kids this way so they can understand what's going on with mom. Sometimes my body is so tired from fighting with itself that I can't do anything else but sleep. Sometimes the pain is so high, the only thing I can do to forget about it is sleep. And like I said, I will say it repeatedly probably throughout this. This is my journey. Everybody with fibro is different. Everybody with MS is different. And that's just what works for me. And that's how my explanation works for my kids too.
Do you think it's important? I think it is, but important to have a good way to explain how you to other people so that they get it and understand.
I believe in total transparency with both. I know that there's a line of thinking, and to me it's sad, but I know there's a line of thinking where you have to all keep it hidden from your family. You don't want your family to see you like that. You don't want your family to know about these silent struggles that you're going through. I know in my household, as soon as I was diagnosed with MS, I told my kids, and I used the MS resources that were newly made available to me. And they actually sent me things about how to explain the diagnosis, how to explain the disease and everything to my children. And that helped me so much. I didn't want them to not know what was going on with me when I was down. I didn't want them to be afraid. And I do believe that knowledge is power. And I think that go ahead.
I was going to ask, how old were your kids when you got diagnosed? Because it was what, a
20. Well, this is 2023. My son is 20. My son was 10. My daughter was 8 when I was diagnosed with MS.
So trying to explain all of these things to an 8 and a 10-year-old that can possibly understand.
The only exposure they had to MS was my uncle. And my uncle had passed away when my daughter was an infant from the complications of MS. My son only knew that MS killed my uncle. And I didn't want him to be afraid like that for his mom. And I explained to him then, my uncle lived with primary progressive MS for 40 years before, and primary progressive is the most aggressive form of MS. And he had lived for, go ahead.
That's one thing, and that's something that I try to, we have to talk to people like they don't know MS at all, that there are different, because to most people, there's just multiple sclerosis, that's it. They don't realize that there's different stages broken down in there.
And honestly, I was reviewing that. I was reviewing the stages and they took one out.
Oh, would they take out? Well, that's totally different.
Yeah, I know.
But there are different stages of multiple sclerosis, and primary progressive is exactly what it sounds like, primarily progressing. Correct. And so it anticipates that you are at a stage where you're just going to primarily progress. There are other stages where you kind of go in and out, right?
Mm-hmm. And that's actually what I have.
Yeah.
And like I said, I didn't want.
That one's called relapsing remitting.
Correct.
And that's what you have.
Correct.
And so the relapsing remitting is where you relapse sometimes and then you remit back to
normal, or as normal as you can be, right?
And but that's an MS talk, but there is a little bit of breaking down to do even when just with the MS part. So you do not have the primarily progressive, you have the relapsing remitting. Correct. Where you go back in and forth, which almost I would think would make it even a little more difficult to tell what is MSD things and what are fibro things.
Mm-hmm. And like I said, the only, and again, this is my journey, but the only thing, every single MS relapse, the one that got me diagnosed was vision issues. And it's in my left. I have had left eye optic neuritis, which means that there's a swelling of the optic nerve that causes damage to the eye. And I was having, I call them wonky eyes. And I know that you and Meg had talked about the wonky eye situation, and I was having wonky eyes. My left eye was just kind of floating around, it was not following my right eye at all. And that was because of the optic neuritis. No signal was getting through that swelling of the optic nerve. And that's what got me diagnosed. And so whenever my vision gets wonky, I know this is the beginning of a flare. It's always my eye first.
Yeah. Which that's something we learn over time, kind of like what is the setup? What are the beginning triggers that we can start to read that say, uh-oh.
Yeah.
We might be having trouble coming.
Yeah. And that's exactly when my eye goes wonky. That's exactly what I say. Okay, here we go.
Yeah. Yeah.
With the differences between the MS and my fibro, there's different kinds of pain. Like I said, MS pain are my zingers. I feel
nerve pain.
Yes, exactly. Nerve pain is electric shocks going throughout my body. Fingers feeling like they're falling asleep and I'm not doing anything that would make them fall asleep, or entire limbs. Oh, my neck feels asleep right now. What's going on here? Right. And then fibro pain, I honestly believe in, and again, this is just my opinion, fibro pain is so much significantly worse than MS pain because it is everywhere. You feel like, for me, my muscles are all tight. Or I've been punched in my hamstrings a couple hundred times. My arms, it hurts to move. The movement that I have right now, I'm not in a fibro flare, obviously, but I'm also medicated.
Right. Well, and that is also the name of the game with these illnesses, right? Mm-hmm. Like, a lot of them are trying to manage exactly. Now, we did have a question or just some input, and can you see it? Can you read it out loud, or you want me to read it, or you want to read it?
It doesn't matter.
Go ahead. If you can read it like you're seeing it, go for it, sister.
Very interesting. My body feels like the depression has now started affecting my body. Okay.
That's a good one.
Yeah, this is a very good question because there are a litany of other psychological illnesses that are attributed directly to fibromyalgia. Depression, fatigue, anxiety. And I also believe vice versa. Having depression can definitely affect your body because your brain controls so much of everything that we do, obviously. And if you're feeling depressed and you give into that depression, it can be hard to move. It can be hard to want to get up and want to do things and stuff like that. And so, yeah, it can directly affect when you don't want to move, don't want to get up and do things that you would normally do. And again, I'm just citing the definition of what depression is from what I remember. You don't want to do things that you used to do, fatigue, and all of the other issues. Your body does get stiff. being depressed can make you, yes, I do believe that it can affect your body, basically, is what I'm saying. But there's so many ways that it can affect your body.
Well, and I think something like fibro
Mm-hmm.
with depression, where you, and even anxiety too.
Fibro that's another mental illness that is attributed or goes in hand with fibro is anxiety, increased anxiety.
Yeah, because you're like holding yourself tighter, you tense up more, or with the depression sometimes goes the opposite way where you just let go more, relax more.
That was a really good question.
That was a good question. It was a great answer, Mel. Because
What do I medicate with, Mel? I
think
have
asking what you medicate with, not what. Okay.
Yeah. I know that, and I'm not going to drop any names, but there are several different kind of antidepressants and nerve medications that are prescribed typically for fibromyalgia, and I am on two of them. I am on a antidepressant and an anti-nerve inflammatory for my fibro right now. And I was recently put on the anti-nerve medication, and so we're kind of still working with the dosages and stuff like that. But so far, we're doing okay.
Yeah. Let's see. I'm just addressing Simon's questions.
My ex has, I'm assuming my ex has it. She has said to me she thinks I could have it or something similar, but I hate to self-diagnose. But this all resonates. Um, what I would do, and again, I'm not a doctor or anything like that, but if a lot of this is resonating with you and your ex who has it says that she believes that could be the possibility, take the steps, because you don't have to. There are ways to help. And, talk to your primary care doctor. Let them know what you're feeling, what's going on, and see if they can't point you in the right direction as far as what to do. Fibromyalgia, gosh.
It's a tricky one, though.
It is. It is a very tricky one. And that's why I'm saying you would really want to talk to your doctor.
Oh, well, yeah, I'm saying talk to your doctor, but the other, when I say it's tricky, because I personally have found it difficult to find doctors that treat fibro.
We were just talking about that.
And acknowledge fibro as an illness.
My rheumatologist recently retired from his practice, and he gave me a list of about 14 other rheumatologists. 8 of them don't treat fibromyalgia, and the other ones aren't accepting new patients. So the last one I asked.
Can you repeat that again? How many are not treating fibro?
8. 8 out of a list of 14 are no longer, they don't treat fibro anymore. And they're rheumatologists. Yeah. Exactly.
Don't treat it. And acknowledge it.
Right. And so thankfully, my neurologist, who's the one that initially thought, hey, you might have fibro, she's the one that is now prescribing me my rheumatology meds. And I know I'm lucky that I have a doctor like that. But if something comes up, I explain to my family that I'll have to talk to a pain management doctor, I guess.
Well, and then there again is another pain management doctor that is treating fibro.
Yeah.
And that is so tough. It's very frustrating.
Extremely.
Well, I don't know, Simon, I don't know if you're still here, but I was curious as to if your ex has it and if she has a fibro doctor. I'm curious as to how fibro is treated in the UK,
Oh yeah.
you know, because we know how it's been treated here. So, it's and I'm thankful that you did have somebody
Oh yeah.
treating your fibro for so long. Like my rheumatologist acknowledged it. And the other thing too is he sometimes they just treat the main thing and not the little things that fall underneath there or in their eyes.
Exactly.
But then you're at home every day like this isn't little.
Yeah.
This isn't really
my rheumatologist, I was really lucky to have the rheumatologist that I had. He not only was he medically or pharmaceutically trying to treat me, he was also encouraging me to meditate, do yoga, keep journals. He calls them what did he call? Oh, dump and toss, where you dump out all of your frustrations or what you're depressed about or whatever. You write it down on a sheet of paper and toss it in the trash.
Sure.
And he was the only doctor that I've ever met that actually.
Who recommended that?
Yeah. My rheumatologist.
That's nice.
Yeah.
Well, and that's a good, like we were talking before about like the depression part of it and it affecting us physically, right?
Mm-hmm.
And so maybe I'm a fan, I'm a fan of dumping trash anyway.
Yeah.
Like just to get it out of you and like onto a piece of paper.
Mm-hmm.
Sometimes that's huge. And so if you can do a little bit of that to get that internal pain that we have off of our bodies.
Oh, carrying around anything like that is physically debilitating. I mean, that's been proven through science that if we carry around too much of the mental, and when I say junk, I don't mean to make light of it, but in my brain, I call it mental junk. Whatever is making us anxious, whatever is making our traumas, our triggers, all of that. If we carry it around for too long, it gets to be too heavy. We can't do it anymore.
No, and that is its own. I mean, depression most certainly has its own side effects, but you definitely will feel it in your body. Tomas has a good question, and it's a carry on. It's like, are fibros similar to any MS symptoms?
Yes, and that's why they're so hard to distinguish. I remember.
Can you use anything as an example now?
For sure. And I'm going to bring it up because it's something you and I had talked about a long time ago. You were having a banding pain around here.
Oh, yeah.
And I said, okay, so I need to know where it is because I can never pronounce it, but it's like chondrodonitis. And this is it's a fibro symptom. Mm-hmm. And it is banding here and here in the upper torso. Then there's the MS hug, which is girdling around your midsection that makes it hard to breathe. Now, honestly, both make it hard to breathe. And when you were experiencing the banding, that's why I had asked you, where is it located? Because it could be fibro or it could be MS.
Right. And now, since we've had that conversation, you had really helped me determine which was fibro pain and which was MS pain, because I'm just like, it's all MS, but it wasn't.
No. I remember that very first talk we had, you were explaining all of these symptoms, and I just asked the question, well, are you sure it's MS, or you have fibro too, it might be fibro.
Right, which I think I was giving my fibro at that, because I'd been diagnosed with fibro, right, when we met.
Yeah.
And but I was not giving fibro any credit. Like I remember when I met Mel and, she says she has MS and fibro. And I'm like, yeah, I got MS and fibro too. But fibro was just kind of like,
Yeah.
For me, for me. And then I'd be like, oh, this is a this, or this is a this.
Yeah.
Like I'd be, and then you were like, do you think that? And that ended up being a hug. But
Right.
then since then, there have been times where I'm like, you think my fibro is acting up? You'll be like, yeah, I do.
And that's, I'll ask you when you have stuff going on, I'll ask you the important questions. Is it a nervy thing? Is it a muscular thing? And that's one of for me, and the way I help you is asking those specific questions, and it's like a mind blown moment when it happens. You're like, you know what? Hey, and it was a mind blown moment for me too. This is not nervy. This is this.
Yeah. And so since then, I have been able to tell which is which. And then even now, because I have the, like the ever crumbling spine.
Yeah.
I've been able, though, to tell that, like, I don't think this is a fibro thing or an MS thing. This is a whole new situation, right?
And when anybody has multiple diagnoses, I remember the first time and I'll get back to what I was just saying in just a second. I remember the first time I looked at when I was being diagnosed with fibro. I looked at this like they were two bubbles, and then they kind of joined together. These are the ones that are both in MS and fibro, and this is fibro and this is MS. And my mom looked at it and she said, Mel, maybe you've had fibro all along. I said, yeah, except for the lesions on my brain and spine.
Right. Because MS has a true tell. I mean, there is it's not like where fibro doesn't necessarily have a showing, right? No. There's not like a test that you can take and be like, oh yeah, there's the markers there in the scan. You can't see fibro.
Right.
Or multiple sclerosis, when you take an MRI of the brain, you either have the spots, which is multiple sclerosis, or you don't have the spots, which is no multiple sclerosis.
Correct. Yeah.
So in fibro, it's more of a feeling and
honestly, like what you're describing, that's exactly what makes it so hard to treat and why doctors are staying away from it now.
Well, and I think part of the thing is it's such a pain syndrome that doctors treating it, I mean, I guess that goes into a whole other thought, is like what doctors had previously to treat it, right? They're not necessarily, the opioid epidemic and crisis has almost put a black spot on doctors that treat pain.
At all.
Yeah, with any kinds of
and it's unfortunate, again, because you personally know my struggles with that. They had me on opioids, they took me off. Then no, it's okay now, so here you can have some. And then no, it's not okay, so we got to take you off and stuff like that. And I getting into the whole opioid epidemic affecting people that need it, that could be a whole other live that we do sometime.
Oh yeah, for sure.
There have been times when I've been very worried about you.
What?
And well, for pain management reasons and things like that. And that's why I introduced you to some other stuff. And
yeah. Well, that's the thing, is just trying to figure out what does help. As far as medicating and stretching,
what I'm doing right now.
Stretching, moving, those things do help fibro tremendously. Even like heating pad, like I have, this is a heated blanket, and the girls know I always have a heated blanket because it does help. So Mel has a heated blanket all year round.
Yes.
because it does seem to help. For me, it helps the best with those joint pains. And
when my lower back acts up, it's hilarious. I have a heating pad on my back and the heating blanket on me.
yeah. Oh, yeah. Sometimes. Now, this is a good one, and I kind of wanted to address this one too. Last few years is like my body is shutting down. Could this be MS? Okay.
Oh, that's yeah.
The thing is that amongst whatever we've got going on, right? And as always, we're not, of course, and I hope that everyone knows, and we'll start doing this as a disclaimer in the beginning, always talk to a doctor and a professional first. We're patients. We're patients that have been through things and experienced our own learning process and have actually helped each other learn. And I think that is wonderful, right? I think having other people in your pocket that have gone through things or have experience is tremendously helpful. I wished that I would have had a support group like we have, for one, side noting. But like we've been able to help each other so much.
Yeah,
Right?
definitely. I know that I get feedback. And it's not just feedback. It's we feed off of each other's knowledge. Right. And as I mentioned earlier in the live, knowledge is power.
Experience as well. Yeah, experience too.
Right.
Other thing that I did want to point out, Simon, and this has been something that, like, I hate to admit this, and he says, I've suffered depression all my life, but the last few years is like my body is shutting down. Could this be MS or fibromyalgia? It could be a litany of things, but the one thing I'm going to point out, because I always forget to add this to myself, is we are aging.
Correct.
I hate to say that, but it is a portion of my situation that I tend to forget.
Who wants to admit that?
Right? It's like, oh man, this little hip in my giddy up. But I am also getting older along with these things. But if those are things that you are concerned about, Simon, I would definitely talk to your doctor and point out why you feel that way. Now, like Mel said earlier, I don't know about there, and that's something I would love to know, Simon, if you could tell me. Are there doctors that specialize in fibromyalgia? We know MS was discovered in the UK.
Yep.
Right? Multiple sclerosis. Why I can't talk.
It was sclerosis, and it was Latin for many legions
of the scars.
Yeah, many scars. That's what it was. Yes, many scars.
Many scars. So definitely, and in truth, Simon, thank you, Dawn, for throwing that up. Always, and that's what always, talk to a professional. We're patients that have supported each other, helped each other, and we're just giving you information from our perspective and what we have learned along the way. Nothing that we're saying is fact other than it's Malena fact and it's Tiffany fact.
Well, and that's, like I said, that's why I've said my journey, because right. Everybody's journey with any of this stuff is their own.
Yeah, there's things, Simon, that we could talk about, like one-on-one.
PTSD, anxiety because of childhood trauma. So I'm just wondering what's going on with my body. Tiff knows how I've been feeling.
Yeah. And I know, Dr. Stigma, MS, and Fibro in the UK.
Interesting.
That is really interesting because MS was discovered there. And Dawn asked me what year it was discovered.
Oof. Hold on, I'll Google.
And I want to say in the 50s.
I think you're right.
But I don't remember exactly what year, Dawn. You know, I try to put a lot in this brain, and sometimes I don't know where it goes out of. My rumpus, probably.
Oh, and another little disclaimer. Tiff knows this very well. I have a very hard RBF when I'm doing things. I'm not angry.
Oh, resting bitch face.
Yes, I have a huge resting bitch face. I'm Googling right now. I may look pissed off, but I promise you I'm not.
When I say WTF to Mel, it's like, what the face, Mel?
Yeah, what the face? What the face?
What the face, Mel? All right, so we'll ask that. And yeah, Simon, I would love to talk one-on-one, like more about some of that stuff. It's interesting.
Oh, interesting.
Yeah.
1868.
Oh, I'm way off. But when did they start treating it?
Okay, let's see. What year was it?
I guess that makes. There wasn't really much treatment for MS for many years.
Treatment.
For many, many years.
Treatment.
Hey, Max. Megan's here. I'll tell you who's here. You don't know.
Oh, yeah. Hi, everybody.
Yeah. Well, we were talking and everybody came in. So let's see. Like Dawn's here.
Oh, my gosh. Okay, so the first MS treatment. Wait, no, that's interferon. Never mind. The first MS treatment was cortisone, a steroid.
Steroid. That's
in 1951.
Yeah. And that was simply, we will give a steroid and see if it will. And that for many years was until interferon, which was what years? 80s?
1993.
93. And we have, to be honest, we have the AIDS virus to thank for finding interferon.
Correct. Unfortunately, but yes.
Right. I mean, because AIDS is an HIV, AIDS is a autoimmune virus. And by all the money that went into finding treatment for AIDS, they started realizing those things would be treatments for many other diseases, like arthritis, multiple sclerosis.
I remember the year I was diagnosed with MS, and I understand that she was speaking from my uncle's perspective. She said, whatever you do, Mel, stay away from steroids. And it was because of my uncle's journey with steroids, because that's all they had when he was diagnosed. He was diagnosed in like 1972.
Right. Well, just in the length of time, I can say from my diagnosis date, with MS,
correct,
which was June 24th, 2010 at 2:45 p.m. Like, it's almost like you remember those moments, right?
August 13th, 10:53.
Yeah, like around in there. And but since then, so many medications have come out just since I have had it. So yeah, most certainly has come a long, long way, even in the past 10 years.
I would say 5 years.
Yeah, I was gonna say that, but even like in the 10 years, we've just like blump, 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 blump. You know, it was like, well, end of it. These two, but now there was only one pill option,
right?
And I wasn't even a candidate yet when I first got diagnosed. Like, I was not a candidate for the pill. I had to do the daily shots.
Yeah, I was gonna say everybody had to start off with the big C.
Yeah. Yeah. And so yeah, it's come a long, long way. And thanks for good or bad, I have not always reacted well to my medicine, and luckily there are other options.
Mm-hmm. Mm-hmm.
So that's a thing, a good thing, really, truthfully. Okay, so Doreen's here, Tomas is here. I'm just saying, Tomas, Dawn, Simon. Thank you guys for coming and being here. And I'm gonna say this one time: I hit the like button if you're here.
Yes.
If you're here. Hi guys, I love you guys. What's the big C? It's called Copaxone, and it is generally a starter MS.
Daily shots. Daily shots of the medication.
Well, now I think they're
Oh yeah, there is a brand of it that is every.
No, I think Copaxone went to every 3
Oh,
days.
it was?
Yeah.
Okay. Well, when I started on Copaxone, it was every day. And then I heard, while I was still on it, I heard about people taking it every 3 days. And I talked to my neurologist about it. And she says, no, you are on the daily dose. They're getting more of the medicine every 3 days. And I said, oh, okay, that makes sense.
Mm-hmm. Yeah, same for me. But then those have oh look, my little friend Kim D.
Hello.
Oh, excuse me, guys. I should have muted. So as far as we're talking about the MS meds, but there is nothing like that for fibro
at all. There's only methods of treatment for the widespread pain. Yep.
Or is that is it really kind of like a treat your symptoms type of thing?
Correct. Exactly. And unfortunately, when I was younger and everything else, I never thought I would be what I call a pill popper. A person who has to take pills all day long. Yeah. And here I am, 46 years old. My morning meds consist of a handful.
Yeah.
And stuff like that. And all of them, except for one, is management of symptoms. And technically, even the one is a preventative and a management of my MS symptoms. So,
yes, that's very true. It is very true. And I think that's also, that kind of goes across the board, right? Like MS symptoms and fibro symptoms. And sometimes none of it works. Or if you're having you kind of have the same thing in your arsenal all the time.
Oh my gosh.
The maintenance, right? Yes. And then if there's any extra flare up in any area, there's not really anything for that extra.
Right.
You can kind of figure out what works for you
to
help you through that extra. Tylenol has been my best friend these past few days.
Well,
and I don't usually take a lot of Tylenol.
So do I. I was taking a lot of NSAIDs.
Oh, yeah.
Then I had to stop taking all of them because of a dangerous blood level that I had come back, and immunoglobulin G, it helps fight infections. But it was very low. And
what does that affect?
My liver. Basically, liver functioning, and it also helps prevent infections from taking hold and becoming really, really bad. And because my level was so low, my doctor was like, no more NSAIDs, which means I also have chronic migraines. I can't take Excedrin migraine because that's also an NSAID. And basically, right now, I'm only on Tylenol for anything extra.
Okay. Thomas says, you guys.
You're welcome, hun.
Yeah, I think it's good to talk about these things, and even in just a sharing. And then, we have more questions and things, we can always talk again. Meg says, I used Copaxone for 3 years. I've used all kinds of MS meds, right? Which makes it a benefit that they're...
Agreed. And I can honestly say the one that I'm on right now, which again, not giving any names or anything, I've been on 2, 3, 4. This will be the one I'm on right now is my 5th. And basically, and this is again my doctor's decision and everything else. My journey is different than everybody else's, but I developed more lesions on my brain. And once the lesions develop, my doctor's like, okay, this medicine is no longer working for you, so we need to switch to something that will. And that's why I'm on my 5th med.
Right. Now, Dawn points out, she's like, oh my gosh, Simon, you're only 28. Your body is freaking young. That don't mean a thing.
Yeah.
Unfortunately, it doesn't matter how old you are. Like Meg has lived her entire adult life with MS.
Mm-hmm.
She also has fibromyalgia.
Mm-hmm.
So it doesn't matter.
And let me just say, Meg's a rock star.
She is a rock star. Most of these guys have met her.
Yeah.
And they, this last Friday, we didn't do a giveaway. Mm-hmm. But I think just because I was so busy, but, then Simon's like, Dawn, I'm 38. Simon, take the 28, honey. Take the 20. Although I get, I'm like, I feel much older than I am, but in my body.
It's so weird. I was going to say, it's my body, not my brain. My brain is like, wow, 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 wow.
And Dawn is also very young at heart. We're all like young at heart around here, and I like that. Yeah, like I couldn't age anybody at all.
I'd gone out last weekend with family and stuff, and something happened, and I used the term cray cray.
Oh yeah. That's all fun, Mel.
My family was like, no 46-year-old person should ever use the term cray cray, and I'm like, no, I can use I'm 46 years old. I earned the right to use whatever term I wanted to say, and cray cray suits it just fine. Suits whatever situation it was.
Right.
Fine. It isn't about age.
Yeah, it's really not about age. And in all honesty, I think if you can, once I got diagnosed with things, I don't know about you, Mel, but well, we've all talked about some of these things, especially multiple sclerosis, right? Because you don't really know how long you've had that.
Correct.
Because the first time they go in and take a look, it's there.
Right.
Not always, but for the majority of people, you don't get an MRI of the brain just because you got a headache, right? Yeah. Like, you got to have some, because, nobody wants to pay for that.
My doctor did the finger follow test when my eye was wonky. And my left eye was not following the finger correctly at all. And that's when he said, we need to get an MRI done right away.
Yes. And sometimes you're fortunate to do that.
Mm-hmm.
have a doctor that's like boom, boom, boom. I was not that fortunate. I mean, I did have the scan.
Right.
No doctor wanted to diagnose me, although I did get diagnosed off that same scan. So it was just, for me, it was a mess to get diagnosed. But I love it when I hear people say, like, their doctor sent them.
Mm-hmm. I know, and I've told you guys before in chat and things like that, that I've been very lucky with the doctors that I've gotten in my corner. And it's not the same for everybody. I used to complain so much because it took, 9 months to get diagnosed. And then I hear people waiting 9 years. And I'm just like, I have been very, very lucky in my, especially the beginning stages of my journey. I bitched because they wanted to do a lumbar puncture, and I'm just like, don't you know it's already there? And they still wanted to do the lumbar puncture. Well, they had to test my lumbar fluid for something. I don't remember what it is, but
fluid. And I think, and I'm not like, we'd have to really look it up, but it's to see if it is dirty, because it's like a closed system. It's almost like a transmission system, like transmission fluid, right?
Okay, that makes sense then.
It have to be touched, right? It just runs the same. I'm no mechanic either. No doctor, no mechanic. Shit. Almost kind of the same thing, right? Where it's like, it should be a closed system. And if something, like if there's rust in there, right? Or if some stuff gets in there, then there's a leak or there's a problem within the system.
Correct. And now that you put it that way, it makes complete sense. In addition to the lesions, they had to make sure,
they check and see if that's dirty. And so that's another indicator.
I was going to say, I whatever they did, I tested positive for MS.
Yeah. And that's, some people don't have to go to the lumbar puncture. And then once I was diagnosed with MS, and that was at the Cleveland Clinic.
Mm-hmm.
And then I came back here, and then I hooked up with my doctor here, who would be my doctor for the next foreseeable years. And he did a lumbar puncture right off the bat. And he also sent me to a rheumatologist right off the bat to see, like, what else is there anything else going on in addition to MS? So that, yes, spinal tap, Meg. Yes, it's a spinal tap. It's the lumbar puncture. It's anytime they go in there, it's uncomfy.
It's so funny because I can tell where my epidurals were, and I can tell where they went in for my lumbar puncture just by pushing on my back down there. I've got 3 different areas that are soup. Yeah.
Like the little knot.
Yeah.
Yeah. All right. Let's do with these. Meg says, I used Copaxone for 3 years. I've used all kinds of meds. Did we already see that one?
Mm-hmm.
Okay. Tomas says he used it for 9 years. Now they got there every 3 days, right?
Yeah.
Yeah, I know. We kind of had it in the beginning of it also. That was a new medicine when around the time we got diagnosed.
I remember that. I remember
because there were other people that were still on like beta seron.
Yeah.
I believe my sister she would take it like on a Friday and like sleep through the weekend, because she really wouldn't feel good. Let's see. Simon says, do you want to read it or you want me to read it? I'd like to give you a turn.
Yeah, that's fine. Don't mind my closed face. I don't have my glasses on, and my glasses wouldn't work anyway. I know I'm aging, but my mom has more energy than me. I will talk to my GP, but it's very hard to even get appointments. Well, I would say in that instance, and I understand the struggle, kind of. Again, I'm not from overseas, but I've heard things. Make the appointment.
Just make it for whenever the hell it is. Like if it's in a year, At least you have something on the books, honey. And
I don't know if they do the same thing there as far as this goes, but we have cancellation lists. If somebody cancels, call me.
yeah. Yeah, and he's right. And that is something here.
There are specialists, but massive waiting lists, stigma, and they just put my ex on morphine and it's ruined her.
Morphine is such a strong medication.
I remember before the opioid pandemic here in the US was as big as it was, fentanyl was the new drug. And they wanted to put my friend who was on fibromyalgia on fentanyl patches. And I told her, this is a new med. They're trying to get it out to the masses because that's how they make money. And you're already on all of these other drugs. I really would stay away from that.
Yeah. And here, I don't even, you wouldn't get morphine. I mean, you can't. No, nobody's going to give it to you like that unless you are really sick.
When I was hospitalized for 6 months, that's the only time I got it.
In the hospital.
In the hospital. And I was very, very sick.
This is so cute. And this is kind of like this just shows the community that we build and how we support each other. And I like it. And I'll just read it.
Yeah, go ahead.
It says, Simon, please go to your doctor and discuss your issues. It could be so many different things. There's a treatment for your symptoms, but we need to know the cause. And I love how she's like, we need to know because we're a team, right? We're a team.
Always.
And yeah, always a team. And so, and that's the thing, with the it's just, you got to just start, right? Just start trying to figure out what it is, what is causing what. And believe me, I've gone in and I've talked to different doctors and they look at me like I'm nuts. They treat me and talk to me like I'm nuts. Not any longer, but
right.
The beginning of me like getting my diagnosis and saying this hurts and it's itchy. It hurts and it's itchy. And this one doctor looked at me like, what is it?
Right.
Does it hurt or does it itch?
Both.
And I just wanted to, because you're not listening to me.
Right.
I'm not nutty.
Well, and you have a medical background too.
Not much.
But enough.
And most certainly not with what I was dealing with.
Well, okay. I see what you're saying. Yes.
You know what I'm saying? Like, I'm more familiar with like emergent things that are happening, not like at that time. Now, over the past years in us, creating a community and getting to know many different people and many different stories and similarities to stories and different things, then I'm kind of like, this is really a thing. That's where I go with the medical gaslighting type shit when they're like,
yeah.
Which is it? Is it itchy or does it hurt? Or is it numb?
Well, and they're in too with the medical gaslighting, following up that with the opioid crisis and the lack of any kind of go home and take a Tylenol. No, do you understand what I'm telling you?
Well, and in my situation, I was in a wheelchair and they continually sent me home like me being in a wheelchair was a normal thing.
Right.
and this is just how you are now. And I'm like, nah, no, we've gotta, I don't know. No. So,
I mentioned this whole 6 months being sick. Then there was a whole situation, and we can discuss that more in detail. But I managed, because of kicking up enough dust around that doctor. He is no longer allowed to perform surgeries.
yeah, I do. I am familiar with that. And I'm not saying, I've had a doctor, a doctor and I broke up.
Mm-hmm.
It was mutual feelings, and that's okay.
Exactly.
You know what I mean? That's okay. And I remember when we were going through that breakup and everybody's like, oh my gosh, dude. And I'm like, no, it's going to be good. It's good. It's a good thing. It's a new opportunity to change things, to
Fresh eyes.
do things. Yeah, right. Fresh eyes, fresh new attitude. Like, I'd kind of got a little bit of an attitude with this doctor, although he had been my doctor for quite a while. And so it was just, it ended up being a good thing.
Well, and you know me, I'm always like, everything happens for a reason, Tiff.
Yeah, I know. Let's see. There's a couple good comments. Okay, I'm going to save that one for in a minute. Let's see. Dawn says, Simon, in the UK's doctors are anything like US doctors unless they ask about your mental health. Don't tell them or they'll blame that. And
very true.
Very true. It's almost like if you already have that to go on, we're just going to blame all that.
Mm-hmm.
They're just going to blame all that. And I actually, in the midst of me not walking, they did a conversion test on me to see if I was in or out of touch with reality, because they were suggesting that I'm believing myself so much that I can't walk. That's why I wasn't walking. So I remember the psychiatrist, I believe, came in and we did a conversion test. Now, they don't tell me that's what they're doing. I know that's what they're doing.
Right.
But
and any lay person in that kind of situation,
they don't know.
Yeah, they wouldn't know, and they would. Oh, how frustrating! How frustrating!
And so, but also at that point, I'm like, hey, maybe if I've created it, I've created it. Let's uncreate it so I can walk. Whatever, heck, And I remember hearing him walk in the hall, walk right out into the hall, and he's like, she's totally in touch with reality. She knows what's going on. Like he felt like he wasted his time. He was like, it's such a pleasure to meet you. I'm like, yeah, I had a good time too. Okay, we did answer that. Oh, wait, let me share this one real quick, because Simon says, true, they do blame mental health for everything.
Mm-hmm.
And they do. And especially if you've been hospitalized for mental health,
right,
they will look at that as well. But I still don't get the bug. Like, you can, I remember I had gone through an episode where I hadn't slept for a long time. You know about that, where I hadn't slept for, like, I couldn't go to sleep. And I was on some heavy medication at this time. This was back closer to the very beginning of my diagnosis.
Right.
And I remember I was sitting out back, and my mom had like little statues and stuff. And like all of a sudden the statues are moving. The cherubs are like strumming their little harps, And like for a little bit, I'm just watching it. She had a little fountain, and I'm just watching this little show. And then all of a sudden I'm like, what the? No, this isn't right.
Right. Yeah.
This isn't right. And so I remember going in and saying, something's up. And when we went to the emergency room, they put me on a, it used to have a name, and it was like an alley that was there was a room there that had nothing, nothing in it but a bed and a camera, right? It was for almost like the worst psych cases. And so they walked me back there. And right. So when you say they blame mental health for everything, they heard that I was seeing things, right? And I've already been, at that time, I had already been to the psych floor because of having MS and not knowing it and knowing what's going on. And there was a lot of things going on in my life at the same time. And then you have that pseudobulbar. Can you explain pseudobulbar a little?
Pseudobulbar.
I mean, you don't have to give a direct definition, but how it affects you, maybe.
Yeah. Well, for me, oh my gosh. Inappropriate reactions to situations. I guess that's the easiest way to put it. In a situation where everybody is crying around you, you're laughing hysterically. Or in a situation where everybody's around you having a great time, you start crying. And it's kind of an automatic thing. And I do believe that in people with MS especially, because the signals get crisscrossed the way they do in MS, your brain sends the wrong signal for the reaction. That's just my opinion of why I do it.
I did look up the definition, and I'll just read it real quick.
Yeah.
Okay. It's a disorder that causes a person to experience uncontrollable episodes of crying, laughing, or other emotional displays that are out of context in their social interactions.
Yeah.
And it says typically pseudobulbar effect occurs secondary to other neurological conditions.
Correct, like MS.
Correct. Yeah. So our responses are not always appropriate. And so that makes it even more difficult, right? Because now I do look nutty too.
Right.
Now I'm looking nutty. No, I'm looking nutty. Let's see. You can read it.
My first symptoms, Megan says, my first symptoms was with my eye, and they were bouncing up and down when I tried to follow the finger. I actually was talking about that earlier. It was the same thing. My wonky eye was not following the finger appropriately. And that's when my primary care doctor said, and when he told me, I freaked out. He's like, we need to get you into an MRI right away. Blah, blah, blah. He says, what your eye is doing says there's something wrong with your brain. And that was all he told me. And in my naivete, I thought cancer. That's the only thing I thought of. I have a brain tumor. I'm dying. And thankfully, when I had the outburst that I did in his office, because I did have an outburst, he calmed me down and he said, no, we have to figure it out. Don't jump to conclusions yet. Let's figure this whole situation out. There's many things it could be. It's not necessarily a tumor.
Yeah, right. That's the thing. There's so many different things.
Mm-hmm.
Guys, so many different things.
Dawn says, I think they do unnecessary tests because that is a whole other subject. I remember, and again, I don't mean to be like, wow, but I have to say this. My son came up to me, and this is the conspiracy theorist in me and him. But he said, Mom, They have the cure for MS. They have the cure for cancer. They have the cures for everything. Right now, being a patient makes them more money. You being a patient makes them more money. And all of the other millions of people who have MS and are doing the same things. And I'm just like, it made me think. I don't like thinking that way because then it goes into a whole snowball thing that I don't like going down sometimes, but it really did make me think. I firmly believe in what Dawn just said.
Oh, well, I know it's true. I mean, I know here in the United States, you can look and see what kind of money that your physician pulls in prescribing certain medication. And that's something that I've looked at before with, because multiple sclerosis medications are extremely crazily expensive. And the doctors that prescribe them obviously get a cut of that.
Yeah, they get a kickback.
Yeah, they get a kickback. And so I have looked up what my doctor will pull in for a medication. And when you look at that, you can see how many times or which medication is paying him out how much. So say if somebody prescribes one $200,000 medication to 10 patients a month, he gets a cut of that. He gets a cut of that. And from every different medication that he prescribed.
Well, and that's what I was explaining to my daughter. Yeah. It doesn't matter how they get paid because I'm not paying it. My insurance company is, but they're still getting their money. And I was like, okay, so let's say the cure for MS was $36,000. One time, boom, $36,000, boom. And my medication per month is $12,000 per month. And I'm just using these numbers as an example. This is in 3 months, they've made that $36,000. But I'm taking it every single month for a year. Every year. Which route are they going to want to go? That one time $36,000 or that 3 times a year for however many years I'm on it, $36,000?
Of course. Why not?
Right.
Which is baloney.
Yeah.
And it's not, to me, it's not a conspiracy theory. It's a truth. But again.
Well, and see, that's the conspiracy theory for my son comes in where the cure's already there.
Oh, yeah.
He doesn't know for sure, but he believes it is. He believes it is.
No, I don't doubt a lot of things. I really don't.
Simon says they prescribe pregabalin for fibro, but for some reason put my ex on both pregabalin and morphine. Now she's a total mess. It's very sad. Ugh.
Morphine is so addicting.
Yeah, that's the thing.
And
we've talked about, and I'm not going to say any names for obvious reasons, but a friend of mine who's a vet in the United States, a veteran, and I believe, and I told her so, and she didn't like it, but I believe that she was being over-medicated for what she has. She only has fibromyalgia, and she was taking a non-opioid pain medication 3 times a day and a very heavy opioid pain medication between 5 and 6 times a day as needed. And then she was on 3 different GABAs, GABA medication, the pregabalin that he's talking about. She was on that. She was on another GABA medication and another. There's 3 that I know of, and she was on all 3 of them. And I just could not believe that she was on all of that medication for the one condition. She was taking more meds than I was, and I have 2. And I know everybody's journey is different. I understand that, but that seemed like way too much, and her quality of life was going downhill. But she would not stop taking the opioid or the other non-opioid pain reliever. She refused. And they kept giving it to her.
Well, I mean, is it helping her? That's where it gets a little sticky. And I'm not saying that's one of the things, like, I do not take any opioid pain medication, and not because nobody's going to give me any. But unless I get a tooth pulled, and then all doctors are alerted about the 10, opioid pills that I got for my tooth.
Yeah, every single one.
Yeah, I don't have a problem with that, them recording it. It's not covered. Pain medication is not covered by my insurance unless it's got a prior off, which I didn't find out till I went, and I had my teeth pulled, and then I went to pick up my pain medicine, and it wasn't covered, so I could wait a few days to get and I'm like, no, I'll pay it out of pocket. But here's another way to fuck people.
Oh, yeah. Yeah, for sure.
Yeah, I don't know a pain med's not covered or, isn't covered till I already had the procedure. It's too late for me to know that now.
Right. When you remember when I broke my wrist?
Yeah.
And how lucky I was that the surgeon that was dealing with, the surgery for my wrist and everything was talking to my fibro doctor about how to effectively treat my pain, because I was already on pain medication at that time. And the two doctors, the surgeon and my rheumatologist, came up with a plan together about how to effectively manage the pain from my broken wrist and the healing process from surgery and everything else. I think, like I said before, I've been very lucky in the doctors that I have had, because I don't know of anybody else that would do that. Like, you're telling me that you got dinged on your medical record for getting that pain medication that you needed for pulling your teeth. That to me is absolutely absurd.
Yeah, I agree.
Dawn says, when I was in the hospital after being hit by a car and I cried because of the pain, I was threatened with a psychiatrist if I didn't stop. And that goes back to the life that you were living then, correct, or no? The Scientology. Yeah. Really?
No, she was already out of Scientology, I believe, when she got hit by the car.
Oh my God.
And it was not an easy hit.
No, yeah, I know.
The remainder. Yeah, it changed her life for the remainder of it. And she says,
now, if I remember correctly, this accident happened in New York, correct?
No, I don't think so. I could be wrong. Oh, you guys, listen. I'm just going to put it up here and let everybody just read amongst yourself, because somebody, they took the time to pop in here and put this up. And
thanks for stopping by. Leave a like.
Yeah. Leave your like, leave a comment. Thank you for adding to the chat.
Oh, no, that actually helped your algorithm too.
Yeah, it did. So, I appreciate that. And everybody can, I don't know how you know what to say, but thanks and peace out, home slice. He's a goner, but I just thought we would share, share amongst ourselves, give everybody a nice little chuckle.
That was
or a moment, whatever. You don't even know who I am. Shut up. But anyway, I don't care about that kind of stuff.
Obviously, neither do I. I'm just like, leave a like.
Yeah, no, I know. I already know how you feel about stuff. So it's like, we're going to put it up here for a second. Just give this person their moment in the sun. Everybody deserves a moment. Am I right, guys?
Oh, yeah.
Oh, no, you're right. nothing. Okay, Dawn did say nothing to do with Scientology, and yes, in New York.
Now, I don't remember what year it was because I remember in another live we talked about it a little bit, but
Yeah.
could it be because the opioid epidemic was so prevalent in
Well,
New
I don't
York?
think so. In New York, I think around that time was 1979.
Oh, okay.
1979.
Interesting.
No, she said no. So, yeah, I believe she was crossing the street, right?
Mm-hmm.
Oh my goodness, this is a lot. Okay, I want to address this one. Crying out in pain is not mental health issues unless the doctors. Well, they're almost you're almost making me crazy. Then you make me look like a drug seeker because
Right.
I'm so much pain and you're not helping me at all. And so then you label me a drug seeker, which means you're definitely not going to give me anything for pain anytime I come. It's
I remember when I was sick for those 6 months and I was actually in the hospital, they had me on a pill and a drip for the pain I was experiencing in there. I don't remember. I missed my daughter's entire second year of life because at home in recovery, they still had me on the pills. So I just, and Dr. Benedict, my primary care doctor, explained that um, I remember too. It was time for me to wean off, and I was fine with that. I was sick of being in the fog, and the smallest dose pill that I was on was the hardest to weed off of because I was afraid of experiencing that pain that put me in the hospital to begin with.
right. Yeah. Let's see. Simons.
Simon says they have her on liquid morphine and morphine tablets as well as some other opiates. It really has destroyed her to the point that she can't be a mother.
I'm so sorry about that,
Yeah.
Simon. And that was something we talked a little bit about the other day, is that addictions can be made,
Mm-hmm.
and they do destroy the person and who the person is, unfortunately. And I just have to say, Simon, that Izzy is so lucky to have you.
Definitely.
And that does, I was just about to say,
Megan says that hurts to think about it like that. I know it's true and it's so unfortunate. How do you get the info on the Dr. Med money?
I should have written that down, but I will find it and I will put a link, or it may be different in every area.
Mm.
It's like called Dr. Meds or something like that. And I'll find it, Meg. And then for anybody else that's listening in the future, probably not, or in the future. But if you want to look for it, I will try to find a resource for it also in the UK. I don't know if they do that because they are not so for profit as we are here in the US.
Yeah.
So I don't know if they, and those things are public record.
And see, that's the interesting thing that most people don't even realize is that, and Tiffany is a great resource that she finds things. And she's the little PI of our group. If we need information about something, she will research it and figure out where to find it for other people, which I think is amazing. And um oh my God, I forgot where I was going with this. MS moment. Sorry, guys.
No, it's okay that we just will look up things and find what we do, or, you know, what we want. And there are so many different resources. Just to mention, I did put the link to fibro.org in the description of this conversation, and they do offer support for people with a fibromyalgia diagnosis, financial help, maybe some assistive devices help, different things. And so it's always nice to know that there is someone out there that has help. You know, being chronically ill is quite expensive.
Extremely.
It's extremely expensive. And that's just living at home with what you need to be comfortable. To
ask an MSer what their electric bill is in the summer with multiple air conditioners running.
Yeah, you know, I did not know. But like my husband, he was like, the electric bill was $300 this month. And I'm like, what? And he was like, well, it was $400 last month. And I'm like, what? Like, I'm blowing my mind. I'm like, I had no idea.
And that's just, I mean, you know, there are energy resources available. Here we have LIHEAP, which is, and because I'm on a fixed income, I do qualify for it, but it's a low income energy assistance program, LIHEAP. And they will, if you qualify for it, they will fund money towards your gas and electric bill.
Yeah.
And honestly, in the summertime especially, that's the only way I've been able to stay afloat, being on a fixed income.
Oh, well, yeah. And, you know, I am always like, you know me, I'm like, if you can save $1, save $1. Especially once you're ill and shit. Listen, if you can save some money, cash dollars in your pocket that doesn't have to go to things that you need to survive, and you could have a little bit to enjoy something.
Yeah, for sure.
By all means, I would rather not spend my dollars on everything to survive, especially when you're on a very fixed income. You know, I know people that the majority of their check will go to just their rent.
Right.
You know, if they don't have help with rent or whatever. So I'm like, you know, when you're in that position, get all the help you can. Keep your money to enjoy some things if you can.
I call it throwing the MS card. I've thrown it several times when I've needed to and when I thought it would benefit me.
People do that.
I'm on MS. I have disability. I also have fibro.
Well, it
saved money on the rent here.
Oh.
It saved money on the rent here.
Excellent. You know, that's the thing, is like you only have so many dollars, right, to play with. And it's like having all those dollars your needs is difficult. What does this say?
Tomas says economic trouble and couldn't hear. They put me in the psych ward.
Like you're just having a hard time and trying to explain. But
oh yeah, that makes
right. And also the thing of it again with multiple sclerosis, sometimes, and you guys have seen me on plenty of lives where I'm like, MS moment? What am I talking about? What's what? And that just gets bigger. One, when you have a lot of stress, right? When you have a lot of things going on your plate, you have a lot of things on your plate, and especially like economic issues. Like for
Right.
me, mathing and trying to like balance and this and that, it will get farther and farther away from me. The
Original thought. Yeah.
the harder, yeah, you try to find it. It just it's like I'm the pack lady.
Well, and sometimes you don't even realize what's going on. Like with my speech issue, sometimes, you know, I
Mm,
we talk about that trip for the 4th of July, and I went and got the cooler with my son. And by the time I got back to where we were sitting, he's like, "Mom, you need to sit down with some ice. You're not making any sense."
yeah, and that's a common thing with heat.
Mm-hmm. Tomas says, one time I went to the ER at the VA hospital because I couldn't hear out of one ear. They said, "You're very stressed out." And I said, "I'm going through a divorce economy." Oh, and then they put you in the psych ward. That's fun. I've had several male and female doc that has not always acknowledged physical or mental pain. It's a matter of being with a doc. Yeah, being a doctor with empathy. Just my 2 cents. And I agree 100%.
I agree 100%. Something I always look for in a doctor is one, that you're looking at me and we're making contact. We're having a conversation. You're not talking at me.
Right.
Don't talk at me. I don't care for that. And I like to have a good conversation, like we're both people. And Dawn says doctors are taught not to feel. And I'm going to say something. The truth is, when you work in those kind of environments, right? And not very often do I give doctors the benefit, right? You know that about me.
Yeah.
But I will say something, that when you work in an environment, never do I say it's okay that they don't feel, or
Right.
but in some environments, you almost have to learn to turn off the feeling,
Correct.
because you will get invested. And that's something I've had to do myself. Not that I didn't care. It was almost, I had to turn off a little bit of my personal feelings to not absorb that so much. So,
My primary care physician, I've had, and I was trying to figure it out, but I think it's been like close to 25 years. He was the doctor that delivered my son.
mhm,
When I needed a second opinion, because I was with a different insurance company that mandated I go see a different health network to have Tegan, my daughter. Um, I went to Dr. Bennett for a second opinion when I didn't know if my doctor through this other health network was doing right by me.
right.
And one of the things that I realized, that Dr. Bennett is just like what you said. He will turn it off in those kind of emergent situations. Like when my eye was being stupid, he had to turn the emotion off. But he always walks in, he looks you in the eye, and he asks you how you're doing really. I know why you're here. How are you really doing? And to me, that shows a level. He knows as soon as he sees my name pull up. He's told me this. As soon as he sees my name on his list of patients that he's going to see, he knows he's going to get a smile. And it's just little things like that to me that are so important. I don't know if I will ever in my life find another primary care physician like him. I hope I don't have to, but I don't.
I know. Well, that's how I am right now. My primary, she took a new job, and here's some new like fresh off the school bus.
So that's how I met Dr. Bennett.
Yeah.
My
And
my original primary care doctor decided that he wanted to become a head of the entire health network. So he did, and I got some newbie. But
yeah, and then sometimes I like young doctors. You know, they're a little bit more open-minded.
he is an amazing doctor, and I know I'm lucky to have him. I've referred family to him. I've referred friends to him. Even when he's not taking new patients, if he sees that I'm the referral, he'll take them.
Right. Hey, Mischief.
Hi, Mischief.
Glad you're here. Okay, let's see. I had a couple. And then Tomas says,
I learned how to play with the system.
well, I mean, especially when your only option is
the VA.
VA. You know, if you are, if the VA is your choice, which is the Veterans Affairs hospitals, if you are a veteran, that is the hospital that you have to use. Using other facilities or other doctors is not an option to you. It's not included in your coverage. They only cover the VA.
I think that just within the last 5 years, they finally allowed emergency situations to be treated at outside emergency rooms rather than you go to one emergency room and then they ship you to the VA emergency room.
Right.
So I know that's happened within the last 5 years, and I'm like, why wasn't this a thing to begin with?
Yes. Yeah. I think Simon might want to come on with us.
I was going to ask you, Miss Tiffany, and that's fine, but is it okay? I need more water. I'm out of water. Can I like mute camera, phone, mic for a second?
Go ahead. Yeah.
Okay. All right.
I'll talk to these rascals.
All right. I'll be right back, guys.
Okay. I do have some things starred, and so I can address those. Done institutionally because but I wish the being in a facility, like a mental health facility, was more constructive. To me, Dawn, your father unaliving himself is a reasonable reason to need to be and not institutionalized. I hate that. I'd rather look at it like taking a break. If they were more worked towards healing, but they don't. To me, if it was a place that you could go and they talked, you worked through some, I think that would be great. But they don't. They don't. And the same with when I was I always, and I hope this doesn't offend anybody, but I always call it crazy town. And because that's just where I say I went, and I just say during my time at Crazy Town, that just breaks where I was. The psych floor or institutionalized or those things don't really fit for me. It doesn't come off my tongue. I call it Crazy Town, and I will gladly tell you I've been there. And the thing is that there were a lot of things going on in my life at that time that it was reasonable for me to need to go to some place like that, or reasonable to need to take a moment away, right? If they would have worked on something. It's almost like they changed the meds to get the most out of you to stay there. And it's a lot. So let me see what I've been missing. Welcome back.
Mm-hmm. Here I is.
Now, this is a good point that Simon makes.
No opiates. No, opiates are not listed as a treatment for fibromyalgia, but they do just prescribe them off label. Interesting.
Well, it is. They do a lot of things off label.
Yes.
A lot of things they realized worked for more than what they got approved for. Because at least in the United States, um, oh, Simon, you want to come on? Is that okay with you, Mel?
Oh yeah, it's fine.
Hey, Snake, how are you?
Hi, Snake.
Here, and let me invite.
Agreed. They're actually, I mentioned it earlier, they're actually doing that with me for one of my fibromeds right now. We're tweaking and figuring out what's working best for me, as far as dosage per day and times to take it and stuff like that. I know Tiffany knows I try to walk every day, and that's so I don't lose the ability. I want to keep my legs strong. And so that's where the tweaking comes in as far as one of my fibromeds go. They want to make sure that I still have the ability to continue doing my daily walks with as little pain as possible from the fibromyalgia.
Right.
Let's see here. Now I knew going back to the off-label thing really quick. I remember asking Tiffany because at first they were prescribing me opiates for the fibromyalgia. I'm like, what is spondylitis, ankyliotitis, or whatever?
Yeah.
And she said, oh, it's like chronic back pain or something, whatever it was. She explained it to me, and I'm like, oh, okay, well, that's why I'm getting the opiates. I didn't even know I had that. And she's like, and then she explained to me then, well, sometimes you can't obviously get opiates for the fibromyalgia pain. So your doctor just put this on as the reason for you to get the opiates. I'm like, oh, okay.
And that's the thing. And that's the thing, I've told you before is like sometimes, like for me, I don't get any opioids, and I don't necessarily want one every day, but sometimes it wouldn't. I'm always like, would it kill for me to have like for breakthrough, right?
Yeah, 5 a month, maybe something. Right. But now, and you may not want to, but like, why is it that you're not prescribed the opioids? Why won't they give them to you?
Why won't they give them to me?
Yeah.
Because I live in a state that is the highest. We're one of the highest opioid. I think we're number 3 on the opioid pandemic as far as states go. And so doctors don't give them. And I don't necessarily want an opioid for every day, right? Or even for, I know people that'll take 6 throughout the day and all that. And if that works for you and all that, that's great. But I don't want to build up a tolerance to anything that when I would really need it, like when I go, even though I take this much at home, when I go into the hospital for like major pain, right? That what they give me is going to be enough because you build up a tolerance and all of that stuff. And
now, were you ever labeled at all?
Oh yeah, I was labeled a drug seeker way back when I was red flagged because I smoked marijuana, and I was open with all of my doctors about me smoking marijuana. And so me being a marijuana smoker put me instantly in that drug addict category. And so, no, we were being real funny with opioids. even now, it's a really big, it's very rare that I even go in with like a lot of pain. And it takes a lot for me to go to the emergency
Oh,
room.
yeah.
You know that. And so it's like, if I go and I go because I'm in tremendous pain. You ready to come up, Simon? Let's go.
Let's see here.
Yeah.
Hey.
We finally made it, Tiff.
Oh, no. Yay.
Can you hear me all right?
Yes.
Nice to meet you, hon.
Nice to meet you, Mel. How are you doing?
I'm doing okay.
I've been listening. I've been doing a bit of gardening and stuff. It's now getting dark, so I've just finished. But yeah, it's been doing a bit of gardening. I've just been listening and sort of messaging when I can. But yeah, it's hard to catch you because of time zones and stuff like that. So
I know.
we will arrange something soon, Tiff.
To catch up.
We'll arrange something soon, Tiff, because especially this conversation and your last one brought up so many things. I've been writing stuff down and stuff, and yeah, there's a lot.
Oh my God, that's so awesome.
Yeah. What I was going to say about the off-label thing, and you did then cover it, there's so many medications that are used off-label in this country. I suffer with, I've got borderline personality disorder, which you can't be treated. There's no medication for that. You know?
Right.
But I also suffer with depression, anxiety, PTSD from like childhood trauma and stuff. So I was on antidepressants for years. None of them really seemed to work for me. I was put on benzodiazepams for my anxiety. Tried to come off them when my daughter was born. My daughter's 9 in 3 days, but when she was born, I tried to come off them cold turkey. I didn't even realise they were that addictive. The doctors don't tell you; they just chuck them at you. Yeah. I ended up having seizures, and I've got epilepsy now because of it.
Oh my goodness!
But and I had to go into rehab after that. My mum and dad paid thousands of pounds for me to go into a rehab to come off it, off a medication that was prescribed by. You know, at the end of the day, I believe the doctors should, no, the healthcare should have paid for that. You know, they're the ones that got me in that mess. But you know, anyway, I came out, you know, reasonably well, you know, off the medications and stuff, but still very depressed and still suffer with depression all my life. But I've recently got a medical prescription for cannabis, which is really hard in this country. So I get the oils that you put under your tongue. I was getting the flower because I used to smoke cannabis a lot, but I find with me, I've got a bit of addictive personality, and if I have cannabis sitting there, I'll just smoke it all day. So for the oil just seems to work better for me. Mm-hmm. So I have the THC oil and the CBD oil, you know, which seems to work really well. It's helping with my sleep a lot better. But yeah, with the sleep thing, after coming out of rehab, I then went to the doctors a few years later and was like, I haven't slept for years properly. I'm not sleeping for days and then just crashing. And then, you know, I'm no good to anyone for like a week, you know, it was just terrible and horrible nightmares. Well, first of all, they put me on temazepam, which is another benzo. I've come out of rehab 2 or 3 years ago. I will put you on another benzo again. I was on that for a couple of weeks and I was like, this is not good. I need to stop, you know, because I kind of knew where it was going. Then they put me on Zopiclone, which is Ambien in your country.
Oh, okay.
Which is basically a benzo as well. It's a similar drug. It's a Z drug. Hypnotic, they call it, I believe. But it's a sleeping drug. Again, I was put on that for a long, long time, and then it didn't work. It stopped working, so I tried to come off it. Had horrible side effects. Really, it was like coming off the benzos again, you know. Then they put me on amitriptyline, which was like an antidepressant I was put on when I was like 18 years old. And they put me on that for sleep. And I'm like, but I'm already on an antidepressant. And they were like, oh, that's fine. Well, since then, I've realised that I was on 2 antidepressants that actually, if you take them in high enough doses, they can cause something called, I forget the name, sorry. It's basically serotonin poisoning of your brain.
Oh, wow.
So, you know, I think, and what I was going to say about young doctors, in this country, old doctors are really stuck in their ways. So they're going to use the medications they were using when they first started practicing, because there's no real renewal process. They don't have to keep training. I think they should have to train every 3 years again. But the younger doctors seem to be more interested in finding the newer solutions to problems. They don't want to go back to the old drugs because they know from their research and their schooling that the opiates, the antidepressants, I'm not saying they have got their place. Don't get me wrong. I'm not saying, you know,
well, again, you have to find the right one.
If you're taking a medication for 2 or 3 years and it's not doing anything for you, it's probably not the right medication for you. I did find one medication that helped me, an antidepressant, that was mirtazapine. and I was put on a very low dosage of that for sleep, and that seemed to help really well. But again, when I started the cannabis treatment, I thought, I'm going to do this carefully. You know, if I start feeling really bad, I'll go back. But I stopped taking my antidepressant. I told my doctor, he knew I was taking the cannabis, and I haven't noticed any bad side effects. I'm not feeling great, and I'll be honest.
Right.
But I'm feeling better than I was. Also, I don't know if Mel knows, I think Tiff knows, I broke my leg at the beginning of the summer or in the spring, and my ACL. So I was put on opiates for that. Dihydrocodeine.
Yeah. Okay.
Again, I probably only needed that for 2 weeks. It took me months to actually fully recover, but it was really the first 2 weeks with the pain where it was just unbearable, sort of unbearable pain every time you move. So yeah, put me on that for 2 weeks. I haven't got a problem. I took myself off that medication 4 weeks ago, so I've been on it for 7 months.
Wow.
The doctors just put you on it, and then
just kept giving it to you.
Yeah.
Wow.
Yeah. So I've now took myself off that. I'm 4 weeks into it, and I'm now starting to see the light. I've felt terrible the last couple of weeks. I felt so depressed. I've been crying more than ever because I didn't realise a lot of stuff happened in between that. I think you know about Izzy and stuff. I've now got full custody of my daughter and stuff. So a lot of things happened that summer, and it was really hard. And I think the opiates weren't just killing the physical pain; they were killing a lot of emotional pain. I didn't even know was there.
Sure.
And when I stopped taking them, it's like I've been looking at my daughter and just bursting out into tears. You know, just stuff like that. It's just been really, really. That's been the hardest thing, to be honest with you. The withdrawals were horrible, but it's the psychological side of it. It's been really tough.
When you were talking earlier in the chat and everything about the depression issues that you've been having and stuff like that, I didn't say it then, but I was going to private message you somehow or something. And I wanted to talk to you more deeply about what's been going on here and there and everywhere.
Yeah.
So just, maybe figure it out. And you saying that you've been taking yourself off of this medication and that had been blocking all of this other stuff besides the physical pain, it completely makes sense. Everything that you've mentioned here in the chat as to how you've been feeling and everything else. You've been dealt like a triple blow, quadruple blow, besides whatever was affecting your pain. You had all this emotional stuff. And being in that depressive state, it can snowball so fast. It'll start from one thing, and then you'll start thinking about everything else.
Yeah.
I'm so sorry, honey. I'm so sorry.
No, that's cool. I'm getting there, I'm getting better, and that's the main thing. I've seen. I sort of saw. I mean, at the end of the day, I could have kept taking the pain meds, and it wasn't until 4 weeks ago, well, a couple of weeks before that, I was like, right, I'm waking up in the morning, taking the pain meds. A few hours later, taking them again. I'm like, my leg doesn't hurt anymore. Why am I taking the pain meds? And why it hasn't hurt for a long, long time, actually. Why am I still taking these? And why has the doctor not been in contact with me to see how I'm doing? I haven't seen, right, Mel, in this country, since COVID, you cannot get a doctor's appointment. We lost 2 aunties and my nan during COVID because you just couldn't see a doctor, and they haven't resumed back to normal. It's practically impossible. My dad got an appointment because he had a stroke, but I got taken to hospital when I broke my leg, and I got some physiotherapy, 4 weeks of physiotherapy, but I have not seen my GP in that time. He hasn't seen me since I done my leg. That was in May, so it's pretty much impossible to get an appointment. I'm not playing this up. You can ask other people in the UK. It's especially in Norfolk where I live. Norfolk is the most underfunded in the UK, the most underfunded county in the UK for like mental health treatment and other treatments as well. So I'm in the worst place in the UK for it. But again, I think a lot of the time, obviously doctors are there and we need them when we need them, but you have to listen to yourself as well. And because again, like we were saying, doctors will try and blame other things for it. And my sister recently broke up with her husband. She'd been together for a long time, 3 kids. She went to the doctor and said, I'm feeling a bit depressed. So he went, okay, put you on this antidepressant. I said, did he ask you what's going on in your life? Because if you'd have told him, I've just split with my husband, we're going through a divorce, I might lose the house. If I was the doctor, I'd say, right, come back in a week, but this is quite a normal feeling. I'd expect, if you weren't feeling depressed at the moment, I'd be a bit worried actually.
Right.
So probably not the best thing to put you on a medication. Come back in a week. If you're still feeling like you need it, then I'll put you on it. But no, we'll just chuck you on. Again, she could have turned around and said, "Oh yeah, my whole family died in a car crash last week." Well, yeah, you're going to feel depressed,
But no questions, no conversation, and that's where I have the problem.
Yeah.
Let's have conversation about.
And I know doctors aren't psychiatrists and everything, but there's nothing to stop them from just sitting there and asking you a few basic questions about what's going on in your life,
No, and here anyway, before you become a doctor, you really do have to work in every area. You have to do your time in psychiatrics, you have to do your time in pediatrician, you have to do your time in, you have to do a little around the horn, emergency medicine, all of it before you can get your doctorate, which doesn't mean you specialize in anything, but it means that you've been exposed to it anyway. That you should have a little bit of knowledge.
A bit of basic knowledge about everything. Yeah.
Right. It doesn't mean they use it. And Simon, I did want to say how proud I am of you, in all honesty, for recognizing that, especially through a hard time, and that's another thing where that's a perfect place for addictions to be made.
I was going to say that
realize it.
Tell me about it. Yeah.
The addictive personality that you have and being able to push yourself or pull yourself off of that is incredible. And
if it wasn't for my daughter, I wouldn't be able to do it. It's purely, and I know people say you have to get clean for yourself or you have to put yourself first before others. And that is true to a certain degree, but I don't think I'd have the willpower to do it if it weren't for my daughter.
I was going to say, in the discussion with you and Dor about addiction and everything else, I know for a fact that if I had been told I would never be able to have kids after the stillbirth of my other son, and then I got pregnant with Jonathan.
Wow.
Had I not gotten pregnant with Jonathan, I would still be drinking.
Right.
Crazy.
Yeah.
Sure. Yeah. So I'm really proud of you for being able to sit. It's a tough thing to be able to sit back and look at yourself and be like, wait a second.
Right.
Well, it's like you say as well. I hadn't even thought of that point of it, but the doctor obviously knows my history. He knows I've obviously got a bit of an addictive personality. I've never been an alcoholic. I've never liked alcohol. I'm so glad of that, because I hate the taste of it. Because if I liked the taste of it, I think I'd probably be an alcoholic. Well, no, I wouldn't, because I got my daughter. But that would have been another issue I'd have.
Right.
But yeah, for the doctor to obviously know my history, and then to just put me on a pain med, which I needed at the time, but he should have then been contacting me every week and saying, "How's your leg doing? Is trying to get these pain meds as quickly as possible, And then he knew as well what was I told. Well, no, he probably didn't know that. Actually, no, he doesn't. But obviously, all this stuff I've gone through with Izzy, and that all happened at the same time within a week.
Right.
So it was like a hell of a lot of stuff happened. And with my borderline personality disorder, I don't deal with stress very well. So in a way, I know it sounds crazy. I think, even though it's been hell, maybe if I hadn't been on the pain meds and I hadn't broken my leg at the time, maybe I wouldn't have dealt with this. Maybe I wouldn't have dealt with this stress as well. I'd like to think I would have, but I don't know.
You heard me say earlier, and Tiffany knows I say this all the time. And I'm a firm believer of this. We don't understand it in the moment, but everything happens for a reason. Everything.
Yeah, I think so now. Yeah. This summer I used to be hard atheist. I've been religious before, and I've been in cults. Well, I'd call it a cult. I was LDS. And then I lost all my faith and became a hard atheist. And I didn't realize actually how miserable that made me. It made me, and I'm not saying that for every atheist, but for me, I didn't realize it made life meaningless to me. Mm-hmm. And recently I've been doing a lot of, I hate that word, soul searching, but not soul searching, but just obviously researching and stuff and reading books. And I do feel, I don't believe in any organized religion. I don't believe in any guru. I think enlightenment, or whatever you want to call it, spirituality, comes from within, and it's a totally personal thing. And I can't tell you what it is. You can't tell me what it is. It's just something that you've got to find inside. And I do feel like I'm starting to find that, which is really cool. Yeah. I do believe it is a purely personal thing. I don't think. I'm not saying you can't discuss spirituality, but I'm just saying you can't say this is how it is, because it's not. It's different for everyone, you know.
Tiffany and I have had several different conversations with regards to spirituality. She knows what my beliefs are and everything else, and she knows that my beliefs are unique to me.
Yep.
And I've always instilled that freedom in my children as well, because I don't want them to do exactly what I do, but this is the way I believe, and find your path.
Yeah. See, when I was LDS, my daughter was born, and that was when I looked. I had problems with LDS already, but you know, the Mormons. But when my daughter was born, I started looking at things and thinking, "Am I really going to expose my daughter to this?" No way.
Right.
And that's when I lost faith, and I left the church. I have an issue with her mother. Her spirituality. She's what I'd call New Age, and I went through that period when I was young, and I've got nothing wrong with that. That's, she calls herself a pagan, sort of white witch, but she tries to push it on Isabel, and I'm like, look, I don't think that's cool. Just, you know, it's fine to explain things or talk about it, but she's like she was trying to push it onto her, and I just think there's if Isabel asks me a question about stuff, I'll give her my answer and I'll say this is what I think, but I don't know, it might not be that way, you know? But it just seems like her mum's more of the this is the way things are, you know, and I don't like that. I think it's something you have to, children shouldn't be exposed to that too much. I think it's, you know, that's quite a deep subject, all that sort of stuff, and I think you need a bit of a developed brain to start to understand stuff like that. I don't know, maybe I'm wrong, but like I think life's hard enough to, you know, navigate through without sort of spirituality can make it, you know, finding your right spirituality can be a real hard task, you know, and can make it, and can muddy the waters and stuff. So I think when you're young, it's just like learn about the world. You've got plenty of time to learn about spirituality when you sort of leave school or when you get a bit older, and you can form your own opinions and stuff, you know, because a child will just repeat what you tell them. If Busy asked me today, like, oh, you know, what happens when you die, and I said, right, well, you go to heaven and God gives you this, and you know, there's angels playing harps. She's going to believe that,
right?
You know, that's the bottom line, I think. So,
for me, I didn't, and I think I've talked about this before. I couldn't put a religion on my daughter. I couldn't say, you're anything, because I don't know that, right? So with her, she would ask me questions about different religions or different things that she heard from friends or whatever. And I would express that, like, this is what I know of what she believes. Right. But for our household, we have to look at what kind of people we are at the end of every day and make sure that we are good humans. We're good humans to other people. You know, I am also a fan of faith in something. If it's a rock, if it's an angel, if it's a fairy, if it's your car parked outside that you feel comes with you a little bit to just help make you a little stronger. You know what I mean? Where it's like, because there are tough moments in life where we're alone, right? And it's nice to have a little something to carry with us. Like maybe for me, you know, I'll be like, my dad is with me or looking out with me, or always, you know, he passed away a couple of years ago. Or so almost more like I'll put my faith almost like in my angels, you know, kind of that are looking out for me.
Yeah.
And that's kind of like where I'm like, all right, you guys are with me. You know, you guys are with me. And I'm just trying to be a good person at the end of the day. And we got to make good choices. We have to respect other people. We have to respect ourselves, right? Yeah. You know, if we steal something, how good do we really feel about that? You know, just being a good person to the world around you and to yourself, you know, and finding whatever it is, you know, this might be a silly thing, but I thought I had one right here, but I used to give my daughter just like a little stone
Yeah, okay. Yeah, I've got plenty of crystals and stuff that I used to have, and I
Like,
give them all to Izzy, actually.
yeah, and I would, like, on a hard day, or if she's having a hard week, or maybe going through a hard time right now, you know, I would hand her this, you know, it's like, this is a love stone, right?
Yeah.
And put it in your pocket. It's just a little stone. You can carry it anywhere.
Mm-hmm.
And when you need a little extra love or a little extra support, remember I'm with you, and you can touch the stone whenever you need to.
I still have a worry stone in my purse because I have social anxiety issues, and if I'm in those situations where I can feel my anxiety go up, I will pull out and I will just rub it.
Yeah, sometimes it's just a nice little also anti-anxiety thing, right? Just to like rub the stone,
like what these kids have nowadays, the fidgets and stuff.
Yeah, the fidget spinners and stuff like that. Yeah.
I mean, I used to, like, when I was younger, before my LDS and any sort of real faith, I was New Age. I was a raver, and we used to put on illegal raves and stuff. Yeah, so we were kind of hippies, I suppose you'd call it. And I was all into my crystals and stuff. And then when I became sort of religious, I suppose, I put them away and just forgot about them. And then when I lost all my faith whatsoever, I gave them all to Isabel. I just sort of found them one day, and I used to have them in like little bags, you know, little silk bags or whatever, velvet bags. And I had loads of, you know, like amethysts and all the different types. And I used to know what they all meant. But I gave them all to Isabel. I said, you know, I don't really use them anymore. You have them. But I've actually started recently using them, because Izzy uses a fidget because she's on the spectrum. So, and I've started using them recently. It's just like squeezy egg, like a stress egg, they call them. And for me, I know it's not a crystal, but for me, it's just something to draw my concentration away from my thoughts, my anxiety. Yeah, I find they do actually really work. But yeah, my faith, I suppose my faith goes no deeper at the moment, as in I just have faith that this isn't all there is. That's because I got to the point where, right, this is just all random. When I die, that's it. You know, this is all there is. I'm not I still wouldn't say like I know that's not the case, but I do have faith that this can't be all there is, and I don't know, my faith goes much further than that, but that at the moment gives me enough relief that I know that this isn't all there is, you know. It's what used to scare me with my atheism, was I was like, if this is all there is and this is my life, then this is going to sound a bit pathetic or a bit, I don't know how to put it, but I used to get really upset thinking one day my relationship with my daughter's going to end and I'm never going to see her again. And that broke my heart. I was like, it can't be limited. And when I started getting my faith back a little bit, I was like, yeah, it can't be limited. This is, we're going to be together forever, you know, whether it's not physical thing necessarily, but, and then during my atheism, I lost the faith. I always used to believe my granddad was always looking over me. My granddad was like my best friend when I was a kid, and he died when I was like 8 years old, and he died next to me. I was laying in bed next to him. He was very ill, and he took his last breath next to me, and I didn't really realize at the time. It was years later. My mum and dad told me, yeah, he passed away then, you know.
Aww.
And then I loved him so much, and I still do, you know, but that broke my heart with the hard atheism. I was like, so I'm never going to not see him again, but he's not there anymore, or he's not part of me. And I don't know how to put it, but now I know I have faith now that he is with me. And I've spoken to my mum recently about this, and she was like, how can you not have faith that you've got a guardian angel? She was like, you've had 5 car accidents that should have killed anyone. You've had so many dangerous accidents in the past, and that, you know, break your leg skateboarding, smash my head open, scootering. Right. She's like, you know, you have, and I had something really bad happen to me in my childhood, trauma wise, that, you know, I nearly died then. And she's like, of course you've got a guardian angel. Like, there's no way someone ain't looking after you. My mum says it's her mum, and it might be, but I believe it's my granddad. You know, I think.
See,
yeah. So.
And for me, it helps me truthfully to think that these people are with me through these shitty days.
Yeah.
You know, it really does. Whether they are or not, I don't know, but it doesn't matter.
It doesn't matter. No, that is right. And it doesn't matter. Yeah. And you can still love science, because that's where I had this thing. I was like, oh, you can't be like really into science and really not level-headed, but you can't do that and have any sort of faith. It has to be, you have to be a hard atheist. No, that's not right. You can love science and marvel at the universe and everything, and not know, but still have some faith. You know, I think not knowing is almost more beautiful, like than having that hard. Right. Yeah, I know exactly.
But that might be something that well, I don't know. I wonder if you feel that way, one, because of the way what you were raised in, being raised in the LDS, it's very much things are this way, period.
Mm-hmm. Right.
You know, so it's almost like growing up with that mentality of it's a has to be, right? Yeah. And so now you're starting to realize it doesn't have to be a hard anything.
No. Yeah.
You know, and I think that's a beautiful thing.
Yeah. When you can't question it, it's and you have issues with something, you either just have to bite your tongue and just not think about it and pretend it's not there, or I don't know, you know. And there were so many issues I had with the LDS, and I couldn't question them. You can't.
Right. You just have to take it.
Same with Scientology and stuff. You just cannot. It's the scripture, you know. Christianity is a little bit different. You can interpret it the way you want to, and all that sort of stuff.
Well, and it is interpreted already all over. You know, Christianity, like kind of across. It's different everywhere you go.
Yeah, I was going to say, and I just want to interject really quick. Tiffany, and I mean no disrespect. Let me first put that out there. But Tiffany knows I refer to myself as a recovering Catholic.
Oh yeah, me too.
Because of the dogmatic view of everything, and and again, it's not as severe as some others. But I questioned. And I was given the answer, it's because this is how it's done. And for a person like me, that's not a good enough answer.
No.
I don't agree with that.
Yeah, I totally. And then I'd say I've always, not always, recently, and certainly since doing more research into religions and stuff, I believe the LDS religion is a cult. It's the cult of Joseph Smith. They pretend it's all about Jesus Christ. I can tell you for a fact, they don't worship Jesus Christ. It's on there. It's on the sign outside and everything. But they don't. Your sermon's all about Joseph Smith, how wonderful he was, how he's the last prophet. Because Jesus Smith was Jesus Christ, was a prophet, and Joseph Smith was a prophet. But he's the newer prophet, so he's better than Jesus. You know, so they don't worship Jesus like they say they do. It's a bit of a scam, I think. But so I'd call it the cult of Joseph Smith. Now I'd call Catholicism almost the cult of Mary, because am I right in that? Because they worship Mary almost more than Jesus. Is that right, or am I wrong there?
The Trinity.
They worship the Trinity.
Father, Son, and the Holy Spirit. And then one of the and you know this too, the prayers recited on the rosary is Holy Mary, Mother of God. And they don't worship Mary, but they recognize that she is the mother
of God.
That's what they say.
Wow. So that almost puts her on a bigger pedestal than God in a way.
Almost.
Yeah. And I think a lot of religions are actually what I'd classify as cults. I'm not going to say they're necessarily destructive, because I think
there's a whole rabbit hole we could go on about this. I love this.
Yeah. I love it. Yeah, I think we've all got the same interest there. But yeah, I think Catholicism can be fine if you don't take it too seriously. I think most religions can be fine, but the trouble is with like the Mormon religion, it's either you're all in or you're all out. Same with like Scientology, you're all in or you're all out. I don't know about Catholicism whether that's like that.
My problem, and the reason why I refer to myself as a recovering Catholic, is the hypocrisy in the church, honestly. And I mean, from the lowest levels of the parishioners to the highest levels in Vatican City, the hypocrisy. You can't say you follow the Bible and do some of the things that you're doing. And there and again, I've said before in front of my children that I do believe that, and this is very controversial, I'm letting everybody know now, but I do believe that the Holy Bible is nothing but a telephone game among men. Like one guy told this story, and then it gets told to this other guy who tells it to this other guy and then it got written down by another guy who interpreted it a different way. And they decided to leave out this chapter, and we'll throw in this one here because this one sounds really good. And I don't agree with any of it.
Well, the King James Bible, which is like what most people use nowadays, I suppose, was created specifically by, was it Henry VIII or one of our kings, king, specifically for like political reasons. So they left loads of bits out, and that's the one we read now. I mean, the Bible has been edited so many times, and you know, I'm not saying there's not good stuff. I do believe out of probably all the religions that I've researched, the life of Jesus and trying to live that example is a pretty good example of life. But I mean, you just look at the Old Testament, and there's some bad stuff in the New Testament as well, but the Old Testament is full of like, you know, pretty horrendous stuff. Yes, and I mean, like child genocide, right, some really, really bad stuff in there. And
I think it was more about control of the masses than any kind of higher power. That's what I believe. Yeah. And again, my belief,
it's just an evolution of Judaism anyway, isn't it? So Judaism was an evolution of Kabbalah. So Kabbalahism, then Judaism, Christianity, and then Islam. And then I think before that, like, where did the Kabbalah come from? Was that like ancient Egypt, or did they? Because I mean, I know the ancient Egypts, I think some of their gods were born on the 25th of December and all this sort of stuff under a star. So it's all just like, oh, we'll just change it a bit.
Really, Jesus's birthday is not on December 25th, really.
Correct.
It's in January, right? I don't remember.
Well, and I know like the celebration of his death isn't really when he died technically on the calendar, and that's the other thing. I mean, there's just so many. I mean, we could go into a deep dive on that subject. And this is something,
in all honesty,
this is something I'm very interested in. I know that during my research, when I lost my son Bryce, I lost faith in everything.
Yeah.
Sure. And that started my spiritual journey, where I was like, okay. And I studied everything. I read up on Islam. I read up on the Kabbalah. I read up on all of these different religions, trying to find faith in something, because my son is gone.
And if there was really a God, he wouldn't let that happen.
That's exactly what I've told my mom this, and I can't believe you did that, Mel. But the day that he was born dead, I did curse God. How could you? How could you let me feel this life inside of me, moving and kicking, and just to take it away? I did not. I did not understand it, and I was very angry. So yeah, I did.
Well, I think I've heard a lot of people be angry with God or their higher power, right? Yeah. You've really let me down.
Yeah, totally.
You know, you have really let me.
But this is where I think, like, this is where I'm saying my faith doesn't go much deeper at the moment. It might grow. I'm hoping it will. I don't know. Well, we'll just see what happens. But I'm not necessarily one of those who's believed God has an active role in what happens on this universe. I'm not like one of them who's like, oh, you know, I don't know what your beliefs are on this, but if say something happened to my daughter, I wouldn't say like, oh, God, like some people say, oh, well, God obviously needed her, so he took her away. And it's like, well, no, if he needed her, why did he do this why would he have even done that in the first place? Couldn't he have found a better way? Like the whole Jesus dying on the cross thing. If God's like this all powerful thing who can actually make changes in the world and do things, putting his son on the cross to die for our sins seems like a really weird way about going about it. He could have just done it a lot easier, you know. So I think there's a lot of holes in that story. But I think Kabbalah. I mean, I've been researching a little bit of Kabbalah recently, and I can't remember what it was exactly. I'm gonna have to go back and read it and talk to you about it again. But there was something in there that really struck me and really like spoke to me. I was like, wow, that it kind of explained where we come from and where we go. Or sort of some idea of that, you know, and it did sort of strike me. I was like, wow, that hit me really hard, and that sort of raised my faith a little bit more. So, and I've never really studied with the Kabbalah much, so I'm going to have to do a bit of, because that's like ancient like Hebrew mysticism sort of thing. So, but yeah, I mean, I think it's one of those things that you shouldn't have your heart set on like, I've got to find. I think it's just something that grows all the time, and just be open to it changing, you know, be open to your views changing. And
that's key.
Yeah. Yeah, you shouldn't ever be stuck hard on a belief. I think you should always be open to new ideas and stuff.
In all honesty, when you have your mind set on one thing and one thing only, and it becomes that tradition or dogmatic or stringent, you're just you're another religion or another cult or whatever you want to call it. You just become that yourself. And I don't agree with living my life that way. I don't encourage my children. Just be open. I told my children once, do I believe in the guy in the sky with long flowing white hair and a robe and a gray beard? I'm like, absolutely not. Do I think there might be something beyond? I don't know. But I do believe in my grandpa. My grandpa watches over me. I know he does. You know, that's what I choose to believe in.
It's exactly the same conversation I've had with Isabel over the last few years. She sort of asked me, like, do you believe in God? And I'm like, I don't know if I believe in the God that maybe everyone else thinks about, like, you know, the Christian God, exactly what you've just said. I don't believe there's a man in the sky. I don't believe it. If there's a God, I don't believe he's got a sex, to be honest with you. Or it's got a sex. I don't even believe it's like a person. Like, it's not me. If it was, it wouldn't. I don't know. But yeah, I explained to her, you know, that's my belief. If you believe that, then cool. You know, just I'll always talk to her about stuff like that. I do. I wouldn't ever not talk to her about it, but I'd always say this is just what, you know, my belief. And if you ever hear anything off anyone else, just know that that's their belief. They don't know. They might, and you might believe it. That's cool, but just know that even if they say, "Oh, I know this for a fact," that's the, you know, that's run the other way.
But you know, exactly. You know, they are also kids, and they're just spreading what they've been told, right?
Yeah, exactly. Yeah. But I mean, she has got her own, you know, I think she sort of believes in, I don't know whether she'd say heaven or whatever, but yeah, I think she believes there's more and stuff, you know. But again, this is what I've said about her mum, you know, I'm cool with her mum expressing her views and that, but don't just push them on her, you know, and don't tell her she's a white witch and stuff. I don't like that.
No.
In all honesty, and I will be very upfront and transparent with you, I do refer to myself as a pagan.
That's fine, yeah.
And but I don't think it's your ex's definition. I pull from everything and kind of do my own thing.
Mm-hmm. I mean, I because paganism, I believe, is that a belief in like more than one god? It's a belief in like the power. Am I right in that?
Well, there's no God. There's deities.
There is no God.
There's
deities, yeah.
Right.
So, and I mean, maybe that is because that's certainly what I used to kind of believe. That's how I was growing up. New age, when we were doing our parties and stuff, it was very hippie, very like pagan-y, I suppose I'd put it. And I mean, I still do have some sort of belief in like a life force, and like, like when I see the ocean and the wind and storms and stuff, I'm like, you know, there's some this energy, and we know it's scientific energy is energy, you know, everything. Where does that all come from, and what is it all about, and where does my energy go when I die? Does it just, okay, my body rots, but then where does that energy go? I don't know. There's just, and again, I'm not talking about souls. I'm not talking about, I don't know. It's just fascinating. So I could go on all night, and I'm not gonna bore you with that bit. Yeah, I'm gonna have to go in a minute, guys, because I've actually got cooked tea, and we've got a trip to London tomorrow. So
fun.
Yeah, that's gonna be great. Gonna be a good day.
Well, we should probably finish up anyway. We've been on for 2.5 hours.
I know. I see, and that's the thing. Like, we had been on for like an hour and something, and then when you came on, I was so happy to talk with you. I'm like, okay, let's go.
Yeah. it's crazy when you do, like, when I do lives by myself, sometimes they can drag a little bit, and you feel like you've been doing it for ages. You're like, oh my god, I've only been on for 20 minutes or half an hour. But when you get chatting to other people, the time just flies.
I know. Get into nice.
You've been going for 2.5 hours now.
Yeah.
No, that's what I'm saying. Let's just all say goodbye. And I appreciate you joining us, Simon.
Well,
really.
thanks for having. I just want to jump in quickly whilst it's in my head, because I was guarding. I hadn't written any. I wasn't writing everything down. It was coming to my head, and I'm like, if I don't say something now, I'm going to forget about it. So,
absolutely.
But yeah, we'll arrange we'll try and arrange a video, a live soon, a time some similar time to this would be great actually for me. This is a good time.
Yeah, it's a good time for me too.
6:30 here, so this is always a good time. So,
Right.
but yeah, no, it'd definitely be good. And it's been great meeting you, Mel, and and you, Tiff, finally actually getting to speak to you properly.
I know.
Yeah.
Love it, love it. So thanks, Simon, for joining us. Everyone's thanking you, and thank you guys for being here. And Dawn, thank you very much for jumping into the moderator role.
Yep, cheers, Dawn.
All right, guys, check out. I want to throw up right quick. You guys check out Simon's channel. At
that's one.
I'm definitely going to be subscribing to your channel too, as well.
Oh, thank you. That'd be awesome. Yeah.
Check Simon out.
Have you got a channel yourself?
No, I do not. Well, I mean, I have like my YouTube thing, but like I mainly come on with Tiffany.
Yeah. Okay.
I don't do lives by myself.
Yeah, so go check out Simon, guys. If you liked it, liked it. If you didn't like it, don't like it.
Yeah.
And we'll see you guys soon. All right. Make good choices, everybody.
Love you guys.
Yeah. Take care. Stay safe.
Peace out.